Good afternoon. Firstly, I'd like to acknowledge Dr. Shuja Shafi for his invitation for us to come to attend this conference and be part of this network. My discussion, this early discussion that I'm going to talk about is going to be very brief because I think most of what I'm going to cover has already been covered by the previous speakers, but it's just a recap in order to build a platform for what's going to happen later on. So when we look at mass gatherings, we need to look at what are the risks that are associated with this mass gathering. You can move the slide. Yeah. So when we look at the risk and in order to identify what the challenges associated with them, we need to look at the movement of the visitors of the host country. The important thing, even before I get here, is that some of the mass gatherings that we have are planned, and we have many that are unplanned. So when we get a host of migrants leaving from a certain country and ending up in another country, that is also a mass gathering, but that is an unplanned mass gathering. So we need to also, in our deliberation, consider the risk associated with those. But in essence, when we look at mass gathering and what are the risks associated with them, firstly, it starts with the movement of the visitors to the host country. Then at the host country, it looks at the visiting population and the local population. The third one is being a participant or a spectator at the mass gathering event. And the fourth risk that also associated with it is around the return of the participants and visitors from the host country. So when we look at this, is how do we then, what are the factors that determine the risk at these various levels? In essence, initially it's the demographics, which everybody has spoken about, how we have a changing demographic and people of older age are the major participants at many of the mass gatherings, the epidemiology and the behavior of the population attending the mass gathering. So here he talks about the health status, the risk behavior during and before, and how prepared people are. What also adds to the risk is also the demographics, the epidemiology, and the behavior of the host population. How do they respond, or what part do they also take in the mass gathering itself? The environment, the climate, the seasonality of endemic diseases at the location, as well as how prepared is the host country for this mass gathering in terms of its risk planning. Now, when we look at mass gatherings and the risk associated with them, all of us have focused around the health risks. And you also have other risks that are associated with them. So when we look at the outdoor events, you can change the slide. Outdoor events are associated with heat-related illnesses, and as a result, you get the complications associated with them. Further, many people have elaborated about the risk of infectious diseases due to the close proximity of the participants themselves. And we also have logistical risks that are associated with mass gathering. So this logistical risk are associated, you can change the slide, around crowd management, security, and emergency preparedness. And when we look at issues around crowd management, you can change the slide, please. Around violence and crowding, what then happens, you need to think about things like stampede and crush injuries, laceration, head injury, and musculoskeletal injury. So all these are associated with violence and crowding. You can change this. The next set of risks are those public health risks related to heat-related illnesses based on the weather patterns, the environmental risks that people have touched upon in terms of food hygiene, sanitation, waste management. Sometimes, in many of these mass gatherings, they are also prone to social unrest events such as terrorism. And the other major influence is the risk associated with the transmission of communicable diseases. Now, what's the role and where do we find the opportunities for public health in mass gathering? So it comes from the understanding of what the role of public health is. The role of public health is to protect the health attendees and participants at mass gathering by preventing or minimizing the risk of injury or ill health. If ill health occurs, is to reduce the disability or disease or death associated with attending mass gathering and to restore the health of participants at mass gathering. So what are then the opportunities that arise in terms of mass gathering? Can you change the slide, please? Okay, so when we look at these, it's a comprehensive set of opportunities where people need to play a role in. When we look at public health opportunities, they involve disease surveillance and outbreak response, mass casualty preparedness, the health facility assessment and readiness. How ready are the facilities? The environmental health and food safety. People have discussed this before, health information and health promotion. And the ability to be able to respond to incidents of explosives and bioterrorism, responses to natural hazards such as weather conditions, and leadership, coordination, and communication. So these form the background or the platform that create opportunities and challenges associated with mass gatherings. I will stop here and will take the discussion forward later on in my next presentation. Thank you so much.